Pursuing equilibrium in medical resource allocation is a pressing global challenge, particularly in developing countries. The imbalance between supply and demand of healthcare resources is exacerbated by limited medical staff, equipment, and facilities, as well as mismatches between supply and demand. Governments and academic communities have made efforts to increase healthcare supply and improve resource allocation, but these efforts often remain passive and inflexible. The emergence of the parallel healthcare system, comprising medicine-oriented operating systems, medicine-oriented scenario engineering, and medicine-oriented large models, has the potential to solve these problems by unlocking the value of data. This system can collect, circulate, and empower data to achieve equilibrium in medical resource allocation. The supply-demand relationship can be balanced by increasing the supply provided by digital and robotic doctors, identifying individual and potential demands by proactive diagnosis and treatment, and improving supply-demand matching using large models. Achieving equilibrium in medical resource allocation is possible through parallel healthcare systems via data empowerment. A case study optimizing resource allocation from the perspective of facility accessibility demonstrates that the parallel healthcare system could result in up to 300% improvement in accessibility. The current healthcare system faces significant challenges, including limited medical resources, mismatches between supply and demand, and passive optimization methods that fail to address potential issues proactively. A healthcare system reform is necessary to enhance the fairness and efficiency of healthcare services. The emergence of new intelligent technologies, such as artificial intelligence, offers opportunities to enhance the supply of medical resources and achieve a global equilibrium by simultaneously adjusting the supply, demand, and matching processes. The concept of parallel healthcare systems is introduced, aiming to achieve medical resource equilibrium through the utilization of technologies such as graph transformers, scenario engineering, and cyber-physical social systems. These systems consist of 5% biological doctors, 15% robotic doctors, and 80% digital doctors. The parallel healthcare system can describe personalized demand, predict potential demand, and prescribe intelligent healthcare supply. Data empowerment is identified as a key factor in optimizing medical resource allocation. The system includes medicine-oriented large models, medicine-oriented scenario engineering, and medicine-oriented operating systems. The framework of the parallel healthcare system is designed to transform traditional hospital information systems into medicine-oriented operating systems, enhancing supply-demand matching and shifting from passive to active resource allocation. MOOS, a medical resource allocation system, operates in three modes: autonomous mode, where it allocates resources autonomously; parallel mode, where artificial intelligence collaborates with human doctors; and expert mode, where experts refine resource allocation using innovative algorithms. MOSE, medicine-oriented scenario engineering, decomposes complex tasks into achievable scenarios, ensuring compatibility with predefined criteria. It consists of three components: identification and interpretation, calibration and certification, and verification and validation. MOSE establishes a robust framework for resource allocation and optimization. Underlying MOOS and MOSE are medicine-oriented large models, which encompass comprehensive representations of the medical system. These large-scale models, including language models, diagnostic models, and decision models, are trained using aggregated data records generated by MOOS and MOSE. They contribute to adaptability and responsiveness through continuous learning and refinement. Large language models, such as LLMs, capture the dynamics of resource supply and demand through natural language processing and machine learning techniques. They transform patient-doctor communication, integrating multiple data sources and providing real-time responsiveness. Large diagnosis models facilitate the supplementation of supply and clarification of demand, while large optimization models enhance resource allocation by leveraging machine learning and deep learning techniques. Fig. 3 illustrates the cumulative value functions in conversations, demonstrating the efficiency of human-machine interactions compared to human-human interactions. The paper categorizes resource allocation into macro, meso, and micro scenarios, each addressing specific optimization objectives and supply-demand relationships. Micro scenarios involve situations where demand exceeds supply, such as hospital bed allocation. Meso-scenarios deal with multiple demands and supplies, like operating room scheduling. Macro-scenarios involve multi-objective optimization across multiple demands and supplies, like city-level resource allocation. The integration of MOOS, MOSE, and MOLMs in parallel healthcare systems enables the collection, processing, and analysis of large-scale medical data. AI technologies unlock the value of data in medical resources, shifting the supply-demand curve due to increased supply from robotic doctors and digital doctors, and more accurate demand prediction. A case study on accessibility-oriented optimization of healthcare facilities in a parallel healthcare system is presented, utilizing the 2SFCA method for spatial dimensions. The paper presents a novel approach to healthcare system optimization, leveraging AI to enhance facility layout and resource allocation. It focuses on balancing accessibility and fairness through an objective function that minimizes the difference between actual and target accessibility. A case study in Nanjing's Gulu district analyzes the current medical resource supply and demand using the 2SFCA method, considering travel time, facility density, and population distribution. The results show a significant improvement in accessibility for both the general public and the elderly, with overall coverage increasing to over 95%. This achievement highlights the potential of the parallel healthcare system in achieving medical resources equilibrium. Parallel healthcare systems have the potential to optimize medical resource allocation and improve healthcare accessibility. The application of medical facilities optimization has demonstrated a threefold improvement in accessibility. However, significant work remains to be done in the future. Constructing medical optimization systems, MOOS, that align with practical application requirements is essential. Integrating MOOS with domain knowledge in medicine is also crucial. Furthermore, exploring solutions to privacy-preserving problems when using large models in medical optimization and learning models, MOLMs, is necessary. The research community is expected to delve deeper into this field, extending and refining its framework and applications. Continuous exploration and innovation in parallel healthcare systems can unlock its full potential and establish a more equitable and efficient healthcare system worldwide. The authors acknowledge the support of various organizations and projects, including the Shanghai Artificial Intelligence Laboratory, the Jiangsu Provincial Institute of Health, and the Jiangsu Graduate Research and Innovation Program. The paper's arguments and ideas are founded on a comprehensive list of 31 citations, including research articles, conference papers, and technical reports.